everyone. I'm Emily. I'm your host tonight. I do content and blogs at ABA. Usually I'm hiding in the background of these things, but Mari's on vacation right now. She's down in the sun and at home in Brazil. So I said I would take over for her tonight. I've got something special for you tonight. For the first part, we're going to talk about detoxing after flea and tick meds. We know it's been a really hard summer, and the ticks are worse than they've ever been, seemingly, and fleas, of course, as well. And we know that a lot of pet parents have turned to flea and tick meds, to get that layer of protection. So what Julie's going to do tonight for us is give us a really thorough, in-depth rundown of how you can protect your pet after you've given these meds. So that's really important. And we'll build the body back up. And then for the second part, we'll do a regular Q&A. So as usual, put your questions in the Q&A, not in the chat. We don't answer them from the chat. We'll answer them in the order they come in. So please be patient. We'll try to get through as many as possible. Yeah, I think that's it. You good to go, Julie?
I am.
All right, let's get this summer mixer started.
Okay. So I'm going to make sure I can share my screen though, because this computer can be a little bit of a, you know what, preview. Let's see. Share. Let's see. Can you see it?
I can.
Can you?
Yes.
Okay. So I just want to make it the view slideshow. There we go.
Perfect.
There we go. All right, so we wind up, oh, don't want it to do that. It's going to have a mind of its own. I can just feel it. Um, so we decided that we have so many questions that we often don't get through. So rather than doing a full presentation about something, we decided that, there was a lot of talk on Facebook and TikTok, and there really is a lot of conversation happening about how dangerous flea and tick medication is. And I 100% fully subscribe to that philosophy. I've seen lots of animals get very, 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 very sick on it. But I also know that life happens, and what we try and do here and at AJ and at Adored Beast is, and even at my all my vet clinics, I try to meet people where they were, because at the end of the day, my biggest concern is the health of your pets. And if we don't talk about it, or we don't address it, or we don't look at it, then or we're embarrassed to say, you know what, I couldn't do any more about this, so I wound up doing flea and tick meds, or I took 16 ticks off my dog 3 days ago and I lost it because I'm so terrified that he's going to get a tick-borne illness, or and so you go ahead and do it. So if that's the case, that's the what part of this presentation is about. And one of it is that is that talking about, okay. So what I want to say is, like, there's no, I just want to see, make sure that, okay, there we go. All right. So detoxifying your body after flea and tick meds. Um, what you do have to remember though, even though we're having this conversation, how we detox, if your animal shows any signs of an adverse reaction, a side effect after flea and tick meds are given, you really need to seek veterinary care immediately and then deal with that aftermath. You can deal with the aftermath after you've seen the vet this way as well, to try and make sure that you're uh, getting to the core, trying to get to the core side effects. So again, ABA tries to always have no place for guilt, because the minute we feel guilty, that we feel like we haven't done our best, or that we've failed our animals in any way, shape, or form. I know for myself, it's much easier for me to feel like I failed myself, and I feel that if I failed my animal, I can hardly bear it. So a lot of people are in this place of if my animal gets a tick-borne illness, I'm never going to forgive myself. And then, but if I give the flea and tick medication, so we're going to go through what if you've given it, what you can do to try and alleviate the side effects. So most of them are neurologic. The side effects are neurological, liver and kidney, uh, neurological, including the brain, the whole nervous system. So how we deal best with that is homeopathically. We use remedies called Nux vomica, phosphorus, and those two remedies are specifically to detoxify the liver and the kidney. So we've got an eye on the kidneys, an eye on the liver, and Nux is very good. Nux is very good for a chemical toxicity. So if animals used to come into our clinic that had eaten anything chemical, that had a chemical poisoning, we would use Nux vomica. If they had an organic poisoning, like if they ate bad meat or something, we would use arsenicum, but that doesn't fit here. So Nux vomica and phosphorus is the two remedies of choice, along with arnica and aconite, which is indicated for inflammation and trauma, and hypericum, which helps to really support the nervous system. What we do here is we put 4 pellets of each one into a cup of water. We stir it really well. Then we use that same water for 3 days. So you use all of these remedies in combination 3 times a day for the first week after using the drug or after using the insecticide, pesticide, whatever you want to call it, the flea and tick medication. Then 2 days, then 2 times a day after that for 1 week. And then after that, what you do is you continue to give the remedies once a week for as long as they're on the medication. This this is for if you've given it and you can't see any side effects. Okay, so you haven't gone through any kind of a adverse reaction or anything like that. If there's an adverse reaction, you use the same like you go to the vet right away, but then you would use the same remedies, but you would use much higher potencies. You would be using either 200C or 1M, but that's not what we're talking about now. We're, fingers crossed. What we're trying to do here is derail them. And there is no guarantee that you can derail, but at least you're doing everything humanly possible to be able to support your pet if you wind up doing the medication. So the next thing is that they really wreak havoc on the gut microbiome. So you want to make sure that you support it with pre and probiotics and fulvic and humic acid. So rotation of bacterial diversity is really important. We want to plant as many diverse bacteria in the gut to keep the immune system healthy. Even on tick meds, animals can still get tick-borne illnesses. I know you're not a lot of veterinarians don't tell you that, but in fact it's very true. I know a couple of veterinarians whose dogs have Lyme when they've still been on tick medication. So it can still happen 100%. So when you give the medication, it works like any drug. Like, so you know how you hear me talking all the time about drugs and playing havoc on the bacteria in the gut. This is no different. It's really hard on it. So what you want to do is you want to try to replenish what the drug is going to, the deficit that this drug is going to make. And then you want a stronger immune system, the better they can fight the illness. So if you're reestablishing the gut flora after the medication, what you're doing is you're basically reestablishing it, helping it to be reestablished. But then I love to continue throughout the summer and well all the time is giving rotations because at the end of the day, if the immune system in the body is stronger, then it'll be able to fight the illness better. Like why does some animals get, 10 tick bites and they don't show any after tick bite year after year and they never show any symptoms of a tick-borne illness? and some get bitten once and they get it. So that's all about their immune system and how strong their immune system is that they can fight it. Organ support. So supports and gently detoxes the portal organs, which are particularly those responsible for detoxing the body. These organs carry the blood to the liver, where it then enters into the circulation. So pay close attention to the kidneys as well as the liver. So when we look at this, we often think we have to support the liver. We have to support the liver. The liver is detoxing. The liver de is detoxing. The liver is just one thing that detoxes. So the portal system, if the portal system isn't clean, then the liver gets hit even harder, right? So the liver gets even more, has to do even more work for the detoxification. So if, in general, dogs or cats with high levels of liver enzymes or animals with allergies or animals with kind of any disease, you really want to pay attention to the liver, yes, but also the portal organs, which is what the liver tonic is designed to do. So kidneys, liver, and portal organs, you really want to support those after this medication. So cell support is another one. So that's what I just said. So when animals are on flea and tick medication, they still can get bitten. Pathogens in the bite can stay in the bloodstream and become cellular or systemic within a few days. You want to support the cells to be as resistant and healthy as possible. And that's why, tick-borne illnesses are so difficult to deal with and to work with often is because by the time the animals show symptoms or people show symptoms, they've become systemic. And once they kind of sort of hide in the cells or set themselves up in the cells, it's much harder to deal with when it comes to even antibiotics. That's why a lot of antibiotics don't work on Lyme and tick-borne illnesses. So, how to support an animal with a tick-borne illness? If you've gone to your veterinarian and they've done the exam and blood work, and yes, your animal has a tick-borne illness, or you're trying to prevent them from getting it, you really, really, really want to make sure that the cells are as strong and resistant and healthy as possible, that they are properly regenerating, that there's proper cell death, so that they can repopulate as a healthy cell and try and sort of overtake the tick-borne illness. And with that in our line would be Vital Defense, Phytosynergy, and Turkey Tail. So if an animal was actually came down with a tick-borne illness, like I said, you've gone to the vets and that's what they prescribe doxycycline. Um, Using Vital Defense, Phytosynergy, and Turkey Tail, I would actually do it all together. Like it's so important to ramp it up right away, and you could do it all together. Or if you're trying to make sure your animal's healthy enough so that if they do get bitten, that they can fight it off, then you can use Vital Defense. When that jar is empty, then you can use Phytosynergy and Turkey Tail together. When those two are empty, then you can go back on Vital Defense. Lifestyle and support. So I can't tell you enough to always check for ticks, even if you're using tick medication. It's really important over the summer, keeping them cool, be careful of them overheating, lots of fresh fluoride-free water. That's a big one. Clean, live, healthy, real food, decreasing stress as much as possible, and obviously loads of love. And people look at this and kind of feel like, oh, well, this really isn't like, something that is an expert opinion or whatever. But I can't even tell you how when an animal is stressed out about something, how it depletes their immune system. And ticks are parasites. They thrive and seem to sense when an animal is either stressed or they're sick or they're old. So it is really, really important. After, if you do find a tick on your dog, then definitely you can use our go-to and go and get. I always tell people to lead them in a homeopathic kit. Should be in their car, should be in their first aid kit. Even go to and lead them in the summertime when you're hiking. Uh, and Leadum is known in homeopathy to be given to help try and prevent a tick-borne illness. So what you do is you give it every few hours, 3 to 4 times, and then twice a day for one week. But if they even show anything like weakness, joint pain, fever, then you need to take them to the vets right away. Getting them, if you're going to do doxycycline, if you're going to do the antibiotics, when you're concerned about a tick bite, the quicker you can get them on it, the more the 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 better the prognosis is if you can get them on it fast. But if they're not showing anything, you can't take them to the vet, go on doxycycline every single time they get bitten by a tick. So even when they're on flea and tick medication, I would definitely do that because, like I said, they can still get it. So for animals that aren't receiving flea and tick medication, these tips are just as important. So every single solitary thing I talked about, everything is equally important. The only thing that you would skip is the homeopathic remedies at the very beginning of these slides in order, that's specifically if you're giving the drug to try to detox the drug. But for animals that aren't going on flea and tick medication, keeping the gut, the liver, and the detoxifying organs and cells as strong as you can possibly make them with, everything I said, healthy lifestyle choices, diet, everything. It's really important. The stronger their immune system is, the better they're going to fight off that illness. Using a topical natural flea and tick product for added protection. I know Rita Hogan, maybe you guys could put it in the chat. Rita Hogan has a book, and Rita Hogan has a, a recipe for flea and ticks. That's really good. Wonderside for people that are in the US, Wonderside. Um, also for people that are in the US, the sustainable herbs. She has a really good internal one. And for people in Canada, we do have something called Atlantic hot tick, I think. And they've shown some pretty good results. In fact, they're even allowed by Health Canada to say that it is for ticks and insects. So making sure that you're spraying that on your animal. And I think Wonderside even has something that you can spray your yard, uh, natural that you can spray your yard. So, reach out, find natural topical ones, make sure your dog and cat are as healthy as possible. And if they are bitten, follow the same homeopathic guide as I said before with the lead 'em and the go-to. And again, if they have any signs of weakness, joint pain, fever, you take them to the vets immediately. And I'm probably going to do um, a talk on ticks and using doxycycline and how to get the body back from doxycycline. And but if you are watching this and your dog has already had doxycycline, then you can follow this exact thing. So just follow this as if you gave them flea and tick medication. So if your animal's not on flea and tick medication, they've been um, diagnosed with some type of tick-borne illness. You've done the medication, doxycycline or whatever antibiotic, but it usually is doxycycline. You can follow this exact thing in order to help repair what the doxycycline has done as well. So that was a quickie because ticks are a very big one, and flea and tick medication right now is a big subject. So I think that oh, there we go. I think that it's something that needs to be talked about because I do know that you know people are doing it because they're scared and it is a scary thing. So hopefully that helps. We'll have that on Emily, will we have that on YouTube or well, it'll be on YouTube for sure that they can go back and watch it. But I guess if they were to email customer service, we could send them out the PDF too if they want the PDF.
I'll send it out to everyone because I think this is really good information that everybody can benefit from. So I'll send it out to everybody later this week or
Okay,
early
good.
next week. So yeah, no need to email customer service. I will send it out to everyone. So if you're here, you will get it. I promise.
Okay, awesome. Yeah, that's probably a good idea because customer service is probably going, oh God, Julie, don't tell everybody about customer service. I always forget that they're overwhelmed. Um, okay, so we can go into questions now.
Okay. Oh, and I've got a visitor.
Aw.
Ah, hi. Okay, get down. Yes, hi. Sorry. I'm so sorry. I'm so sorry. All right, our first Jones, go lay down, baby. Go. I'm so sorry.
Oh,
Okay. She's usually so
that's all
good when I
right.
sit here. Okay.
Just she's fine. She can just hang out on you.
So our first question's from Amanda. Amanda says, I've been hanging on to 2 bottles of Jump for Joints for over a year now. My 9-year-old dog definitely needs joint support. However, the ethanol has me concerned. He has a small fibrous liver that seems to be functioning okay, but I just don't know if the ethanol is a bad idea for him. He's been taking Myos, Fortitropin for building up his
Yep.
muscle mass for 3 months. Any insight would be very appreciated.
It's easy. It's really easy to do. Just take the jump for joints and take some spring water and pump it in, pump like maybe 3 to 4 pumps in a this will actually make it last longer for you too. Pump it into some spring water, like a cup of spring water, and then give him a couple of teaspoons. What kind of dog is it? Does it say?
She
No.
doesn't say.
Oh, okay. So depending on the size of your dog, if it's a large dog, you could give like a tablespoon of the water to him. You could just open his mouth and put it in his mouth, or syringes are always the best because then you can lift their lip and just squirt it on their mouth. And that way, they're like the amount of ethanol would be like you wouldn't even know that it's in there. And you could use that for 3 days. So, and then dump it out and then do another one. If you're finding that maybe it's not working as well, then just do that every day. So put what you would give him, what you've been giving him in his mouth or in his food, put that in water, and then just take a tablespoon of that water each time you're going to give him the jump for joints. It works. I do that all the time.
Perfect. Annalise would love to know if the same detox applies to intestinal parasite meds. Great question.
Yeah, it can. Yes, absolutely, for sure. Because it's any kind of insecticide, antiparasitic can have a pretty harsh, well, they all have a very harsh um, side effect on the gut, but they're all pretty hard on the kidneys and the liver, and they're all pretty hard on the neurological system.
Yep, makes sense. Oh, hopefully you didn't lose me. Can you hear me? Oh, there we go. Okay. E. Ward is wondering if there's anything holistic we can give to our kitty, seeking to improve quality of life, not quantity. They have a 14-year-old female cat. She's had chronic respiratory issues, sneezing and coughing over the last 5 years in the spring and fall, and sometimes during the winter. Recently, she developed a grape-sized bump on the bridge of her nose after we had a smoky kitchen disaster. Oh no. She was put on 2 different rounds of antibiotics and antivirals. She had blood mucus discharge coming out of her nose and right eye. The bump went away momentarily, then it came back within 48 hours. The vet put her on antifungal drugs and tried to aspirate the lump. He had a hard time aspirating it, said it was a bloody pudding consistency.
Yeah.
Oh, he was able to get barely enough out to send to test for fungus, waiting on fungus test results, and meantime have started antifungal medications today.
Hmm. So he had this kitty has had respiratory issues for 5 years, even prior to the kitchen smoke, right?
Yes.
Like recently, yeah, recently developed a great size bump. Oh, my goodness. Okay. Well, the first thing that comes to mind is our homeopathic remedy called Rebalancer. And Rebalancer has Thuya, which is incredibly antifungal. And it can be antifungal systemically, like if there's fungus systemic, or if there's like a section of fungus, like if this is fungus, Thuya is really, really good for that. It also has silica, which is also really good for like this because he couldn't aspirate whatever's in this little bit of a mess on her nose. Silica really helps to support the body absorb foreign material or push it out. So let's say you had a sliver and it was the tiniest sliver that there's no way it's going to push out. So it would probably just eventually dissolve. It will help it dissolve that tiny sliver. If the sliver's too big to dissolve, then the body will actually, with silica, help to wall it off and push it out. So this could be very helpful to help your cat, especially if it's bloody, then hopefully she'll be able to reabsorb it in her body, then can deal with it. Fingers crossed. And I would give that to her 3 times a day, just ongoing. It's also good for sneezing, not great for coughing, but good for sneezing and actually also good for postnasal drip, which is often why with kitties the coughing happens because they are getting their nose gets really stuffed up and then they get like a postnasal drip and then they cough from that. But what would be really excellent for that is feline gut soothe. And lots and lots and lots of asthma cats at my clinic or feline upper respiratory stuff or chronic respiratory issues. Feline gut soothe is incredible because one, it feeds the gut microbiome, so helps with your cat to be uh, more immune modulated, right? So she's not going up and down. And also really helps the gut microbiome with her immune system in general. But the N-acetylglucosamine in it is a smooth muscle, works like an herbal smooth muscle anti-inflammatory, but it's or a nutraceutical is what that is. And it the same as glucosamine kind of works as an anti-inflammatory in the joint. And acetylglucosamine helps as almost like an anti-inflammatory, but of smooth muscle. So any cat that I saw at my practice that had asthma immediately went on that. I have horses with COPD. They're on the equine gut soothe. It's incredible. We have lots of dogs that have, you know, uh, problems with breathing, especially things like boxers and Frenchies. It really helps them because their nasal cavities become so inflamed because there's so much pressure. They're so short. So feline gut soothe for sure, and the rebalancer is what I would 100% recommend both of those for your kitty. Questions to her response.
Sorry. Oh,
Can I, oh, where'd it go? Can the rebalancer while she's on antifungal? Yes. Would colostrum be helpful to reset her immune system? You have to be very, very careful. It depends on what's going on with her. Yeah, colostrum or R positive immunity, which is our colostrum alternative, if you can if you can stimulate and support IgG and IgA, which is what colostrum does, without it becoming systemic, is what you really want to do. So our positive immunity, which is our, like I said, our colostrum alternative, the reason that I chose, one of the reasons that I chose it was instead of using colostrum, it's much more ethical when it comes to animals, but it attaches to detoxify as well. So it attaches to um, inflammatory cells, and it actually they excrete it through their feces. So you can do that for sure. But yes, antifungals, you can definitely you can still use rebalancer with antifungals.
Perfect. Okay, next question comes from Roxanne.
Another
Oh,
another
sorry.
cat question. Another cat question.
And it's two parts here, so just bear with me. My cat has been vomiting with a frequency between once a month to twice a week for the past year. This vomiting is on an empty stomach first thing in the morning, clear, frothy liquid, sometimes with grass. She also vomits food immediately after eating, up to 40 or up to after. Oh my goodness, up to 40 minutes of eating. In addition, she's itchy, sheds a lot of fur, and has general tendency towards constipation, alternate with occasional soft, very smelly feces. No definitive diagnosis other than acid reflux. Conventional vet suspects food sensitivities or IBD. A Nutriscan test was clear. Microbiome tests showed dysbiosis. Hair mineral test also indicated inflammation and sympathetic overdrive. With low levels of Ca, Mg, Ka, and high sodium. I'm very sorry, I don't know my periodic table. Aluminum were also elevated. Uh, Her cat has been raw fed for 5 years before these issues with a large variety of proteins, moved to a cooked diet this spring, which seems to have helped a bit. Tried a number of supplements, including Gut Soothe, Felix Flora, Liver Tonic during the past year without results. Since mid-May, Roxanne has been using homeopathic treatment with Morgan Bach Nozode
Bob
200C.
knows.
Okay. Once a
Yeah.
week with phosphorus 6C daily, but unsure if it's really working. Some general improvements seen, but certain symptoms such as itchiness and shedding persist, and there are 2 episodes of vomiting since starting it. Any suggestions?
Okay. Um, so what I would suggest with that, oh my goodness, it's really bright. Hold on a second. Ah, what am I doing? Hold on a minute. Sorry, hold on again. Hold on 1 second. I don't know why my computer is doing this. Hmm. I've had computer difficulties all day today. Bit irritating. So number one, we did a very long inflammatory bowel disease IBD lecture. It is on YouTube. I would highly suggest that you watch that because that's reading it, that's what I was thinking as well. The the sympathetic overdrive part is really, really interesting. Um, she's a cat though, and if she's in pain, I mean, everything's making sense. What I think's missing in the IBD lecture, Emily, do we have that somewhere else or just on YouTube?
The PDF we have,
Okay. So maybe we can send Roxanne the PDF
I
because
will,
that would be good if there's a way for her to um, send in her email for that.
sure.
And
She did say she watched the lecture already,
oh,
but
good.
and there
Okay.
Michelle shared the link. But yes, if you do
You know
want
what?
the PDF, put your
Did she try any of those remedies? Like iris and arsenicum and things like that? Did she say whether she tried them?
she hasn't mentioned.
Okay.
Maybe she'll
All right. Maybe she can put that in the chat, whether she Roxanne, can you let me know whether um, you did try any of those remedies? I know I can see, sorry, I didn't know where that was. Okay, sorry. Has been on raw fed. So gut soothe, Felix Flora, and liver tonic. Okay. So the only thing that you haven't been on that I would say is important, what I would try is I would actually try doing the feline leaky gut protocol. And in that protocol, when I look at this and I listen to this and I hear, it's been going on for about a week, and I listen to that yes, she's got dysbiosis and she has a her sympathetic system is in overdrive, low level, and the low levels of her minerals tell me that she's not absorbing properly, right? She's not absorbing things correctly. And I would try her on I definitely would try her on the feline gut soothe for sure. And then in feline gut soothe, there's a remedy called gut seal. And that's what I'm really focusing on right now. And in that remedy is something called it's a combination remedy that helps to break down scar tissue and helps to decrease the any kind of adhesions or scarring in the gut. Because when the gut starts to heal, the problem is that where it heals, it's just like an injury or a trauma. It heals and then it scars. It can scar. So even if the gut is healed, we can still see sort of symptoms of IBD or symptoms of lack of absorption because of this thickening that happens. So I would try the actual protocol or the actual protocol. And then the other thing I would do is I don't know, have we heard from her? I don't know if you've tried the remedies in the IBD, but that's what I would do for sure. Morgenbach, definitely from Roxanne. Hold on.
Oh, so oh, sorry,
Oh,
Roxanne.
okay.
She watched the lecture. She's still on the things that were recommended by the homeopath. She's
Yeah.
still on the Morgenbach 200C and the Natrum Phosphoricum 6C. Oh, she's in the UK, so she can't get the leaky gut or the gut seal. She looked for it already.
Um, we do have it in the UK. We do have it in the UK. So maybe again, reach out to someone. Um, uh, I would reach out to someone about that. You'll definitely be able. Yeah, Sue Armstrong is amazing. Dr. Sue Armstrong in England, she's incredible, and she has a clinic. So if you can get to see her, she's wonderful, wonderful, wonderful. She's a really, really good friend of mine. She's a veterinarian that's just brilliant, like one of the most brilliant vets I've ever known. So maybe you could go and see her. But I'm pretty, I don't know if we have the protocol there or not, but the one remedy is thiocyanine. And the reason that I'm saying, did you try the remedies in the IBD lecture, is because now that you've done Morgenbach is a big also clearing remedy. So it helps other remedies work better. So now that you've done the Morgenbach, other remedies may actually work better as well. The other thing you could try is CBD oil with like zero THC or less than 0.03 THC. You could try that as well. But it does sound IBD-ish, and I feel like there's so much you can do. Cats can respond so well. Like two homeopathic remedies that I've worked with a lot with cats with IBD or similar symptoms to this is arsenicum and carcinosin. They seem to really, really trigger a positive response in cats with IBD. But look again at the lecture. Try to see maybe where your cat is. See if you can get those remedies there. Reach out to Dr. Sue Armstrong. Do we have her contact? Pretty sure we have her contact. Kaylin, do we have her contact? Uh, and see if you can get a hold of Sue. That would be really helpful because she's a veterinarian, so she'll also be able to do a bunch of other stuff with your cat and go from there. Usually when gut soothe doesn't work or Felix, usually when the actual gut soothe doesn't do anything, to me, that's saying that there's a lot of thickening and you have to do the other steps as well. And if she's been vaccinated, it'd be very helpful to do like the rebalancer as well. But your Sue can do all of that for you. Like everything that I've just said, Sue could do for you.
Perfect. Thanks, Julie. And hope that helps, Roxana. Okay, the next one is from
It's really
Tracy.
difficult when they're like somewhere where they can't get stuff for sure.
So, and a lot of homeopathy is now hard to get in the UK. Kaylin's just letting me know, so that might be tough as well.
And it's crazy because it used to be the place. It's
Hmm.
where I did all my training in
Yeah,
the UK.
wild.
I know.
Okay, Tracy says, I have a seven and a half year old complicated French bulldog. He was born a cleft palate. He has had 7 surgeries. He has chronic mucus, antibiotic-resistant UTIs. He's very delicate. Right now, I need help.
Okay. So Tracy, hopefully you heard me talk about N-acetylglucosamine and Frenchies and boxers, bulldogs, all those guys. And 7 surgeries, that's the same thing that's going to happen, right? There's going to be adhesion, scarring, thickening. So when you do the surgery, it helps, but then you also have to really address that thickening and that scarring. So for something like this, I would definitely use I don't know where you are, but I definitely would use Gut Soothe for sure to help with the mucus and I don't know if the dog's ever been vaccinated at all, but I would also definitely do rebalancer because of the scarring. The silica will really help with the scarring. And we have a remedy called Gut Seal that I was mentioning before that helps to break down scar tissue. It comes in the leaky gut protocol. So I mean, there's no reason that you couldn't do the leaky gut protocol. But the antibiotic resistant UTIs, we have a protocol called Easy Peasy, and it's incredibly, incredibly helpful for chronic UTIs, like really helpful. And I'm wondering if he's getting chronic UTIs because he probably went on antibiotics after all of his surgeries as well. So, first thing I can think of is supporting the gut 100%, getting the N-acetylglucosamine in there as well, and the slippery elm and the marshmallow root, everything to take down the inflammation in his sinuses. And that's there's Tracy, are you in the US? Can you let me know if you're in the US? If you can also get help from a holistic veterinarian or more specific help with homeopathic remedies. But surgeries with all of the antibiotics, all of the sedations, all of the anesthetics, all the drugs that, NSAIDs and everything that comes after surgery. I would be supporting his liver. I would be giving him gut soothe at a minimum, or potentially even the leaky gut protocol and rebalancer and um, uh, the easy peasy protocol as well.
So she did answer, sorry, at the very bottom of the Q&A, which I'm not looking at, but I should be. She said
Okay.
he currently has 2 large stones in the bladder, just finished
Oh,
macrobid 100 milligrams 3 times a day for 10 days for staff. Uh,
yeah,
she's using Easy Peasy 1 and 2, Rebalancer, Liver Tonic, Phytos, 5 Defenders from Real Mushrooms, Colloidal Silver, Natura Pets Organics, UTI Warrior, Stone Breaker, and Seal 'em and Heal 'em. The holistic vet put him on standard process Fengra, I'm sorry, Albaplex
yeah,
and energetics.
yeah,
Um, they didn't work. Traditional vet consistently recommends prednisone, doxycycline, Mucinex, Zyrtex, and Afrin. She tries homemade. food or raw and wind up repeatedly going back to prescription urinary food for UTIs and stones. And yes,
Okay.
in the US.
In the US. Okay. So when it comes to the bacteria, if you can find a homeopath there, they can actually give you a homeopathic remedy specifically for that bacteria. So we had a couple cases of a really really intense bacteria called Pseudomonas in our clinic and was completely antibiotic resistant as well. And there is a actual homeopathic remedy called Pseudomonas. So we treated this dog with that and it cleared it right up. And it's going to be difficult with this chronic, and you're going to go in these little circle things with this chronic UTI because the body knows that those stones are in there, right? So the reactive state is going to be happening. I don't know how often you're giving the easy peasy homeopathic. If you're giving it once or twice a day, you could give it 4 to 5 times a day and see if we can budge those stones at all. I would definitely try that, but I would also, sometimes I'm thinking, with something this intense is potentially a fecal transplant. And the poop pills that I would recommend would be a company called Legacy. I think that they're probably the better, in my opinion, that would be the one that I would reach for sure. So you could try the Legacy fecal transplant pill, the poop pills, just to see if you could give his body a little bit of a kickstart to see if he can himself um, help to get more resistant against this particular bacteria. But if you can find out what bacteria it is, there could actually be a homeopathic remedy that addresses that particular bacteria, along with uh, doing the easy peasy homeopathic liquid, 3 to 4 times a day.
So Tracy said it's Staph pseudo-intermedius.
Staph pseudointermediate. Yeah, so there are uh pseudo bacterias in homeopathy, and the cool thing about it is it doesn't have to be exact. So if you're in the States, um trying to think who you could reach out to when it comes to homeopathics. That would have that. I have to think about it. Maybe we can get her email and I can try and think what vet might have those particular remedies.
Tracy, if you want to send me your email in the chat, I'll save it here and Julie and I can chat tomorrow.
Yeah.
Oh, and also ask, can I increase the dosage of Easy Peasy?
The powder?
They didn't say.
Yes. Yeah, you can. Um, French Bulldog. Yes, you can. You can increase it. You could do 1.5 times the amount, and you could do it like you could separate them from morning and evening so that he's getting it twice a day. And then you could do the liquid, like I said, four times a day. You could increase it to 4 times a day.
Perfect. Okay, yes. So send us your email and we'll get back to you, Tracy. All right, the next question is from Diane. My young golden retriever suddenly prefers to have her first meal later in the day, around 2:30, and then dinner around 8. She isn't interested in eating in the morning. For humans, they say breakfast is the most important meal. Should I be concerned that she isn't having a morning meal?
Hmm. Can you find out if she's intact or if she's spayed? Because
Diane.
I've seen this in unspayed females when they're hormonal, they get a little bit like not so hungry in the morning. But the only time that I would be worried about something like that is, um, if anything else is unusual or going on. But, you know, or if there's a potential for acid reflux. So if she's waking up in the morning and she's feeling nauseous because she's building up acid overnight, I mean that's a potential too. You could, talk to your veterinarian and ask if they feel that there's a problem. You could also 8 o'clock, I mean that's pretty late to eat, so I wouldn't think it was that, but that would be something that could have a potential. But yeah, I mean, sometimes they just don't want to eat in the morning. Like I've seen that lots. But on the same hand, just we might want to just get her checked out. But she could be if did she write in whether she's neuter or whether she's spayed or not?
She did. She just said she's not spayed. Her first heat cycle started this week. She stopped being interested in breakfast about a month ago. Funny
Yeah.
that.
Yeah. So that's probably that I would say that that's maybe what it is they wake up and it's almost like they get morning sickness. Like they can get very hormonal and kind of semi-nauseous in the morning. I've actually seen that quite often. But again, if she's showing any other weird signs, like if she's gulping or lethargic or anything like that, you should probably get her checked out. And if you had said that she stopped eating in the mornings after she started her heat cycle, you always have to watch for pyometra. I think probably know what that is. Um, it's an infection if they're not spayed and they get uh they can get false pregnancies and their bodies think that they're pregnant and then their uterus can close. It can be an open or closed pyometra and they get an infection and it can be massively life-threatening. So always watch. Like the first heat cycles are such a window into your animal's health, like for proactive care if you're not going to spay her, or maybe you are going to spay her after her first heat, I don't know. But if you're not, then really watch so that you can gauge every heat cycle. It's so important to make sure that you're aware of what's normal and what's not normal for her. Like does she go into false pregnancies? Does she, get cuddler toys? Does she nest? Does she do all of that stuff? Does her vulva get really swollen? And you want to make sure that there's no signs of a infection like a pyometra after.
Really important stuff.
Very important. But like I said, I have seen that.
Hopefully that eases your mind a little, Diane, and you can investigate further if you need to. Thanks, Julie. The next question comes from Colleen. She has one about her AT Athena. I'm not sure if that's the type of dog I've never heard of before or if it's perhaps a typo. Apologies. She's had lots of GI distress and she's just been in the emergency vet. I want to put both my cats on the leaky gut as I've had very good success with the gut soothe. However, she's just also had a bad UTI infection, and I had started her on the Easy Peasy again. How should I rotate these as I now don't want to take her off the gut soothe, but all the probiotic blends I'm worried about too many probiotics.
Mhm. Okay, well, that's fair enough. Um, Easy peasy and Gutsuit are pretty similar. They're actually quite similar. So you could rotate them, but if she's just had the UTI, I would keep her on that for 2 weeks, and then you can put her back on Gutsoothe. But if you want, you can if she has a tendency to have UTIs, you can alternate them. So and I don't mean you can do a couple things. You can do one jar of gut soothe when it's finished, go on to one jar of easy peasy and back to gut soothe. So you can rotate them like that, or you can literally rotate them daily. So you can do one day easy peasy, one day gut soothe, one day easy peasy, one day gut soothe. And when you're doing with all of them, like if you're using the digestive enzyme if you're using digestive enzyme and liver tonic, and the homeopathic gut seal, that can still be given with easy peasy. So you don't have to stop that. So you can continue your feline gut or feline leaky gut protocol, no problem.
All right. The next question comes from Amneris. My rescue, approximately 16 years old, has had multiple GI issues. He's now on probiotics, love bugs and healthy gut, and also omega drops. His holistic vet wants to do fecal transplant, and I'm apprehensive for multiple reasons. He's an older dog, any pains, stress levels, etc. Please help. Any suggestions? We do microbiome stool samples 3 times a year.
Hmm. So 16 years old, has had multiple GI. He's now on probiotics, love bug. Can you say whether how he's doing? Like, is he doing well or does he still have GI issues?
He's
He's
doing
doing
better. Sorry.
bad. Okay. How long has he been on I'm looking down, I'm looking at your responses down here. How long has he been on the supplements? No GI since January. Oh, that's awesome. And since December. Okay, good. Well, is there a reason? Can you tell me why they want to do a fecal transplant? I don't know whether she can or not. Um, so fecal transplants
Oh,
are really, really,
she said
oh,
because
oh,
they said, yeah, dysbiosis.
dysbiosis. But dysbiosis takes up, it is over 7. Is over 7. His dysbiosis is over 7. Yeah, but I mean, if he's only been on December, January, February, March, April, May, June, July, it's going to take a while. It's really going to take a while. Now, I have nothing, like zero, against fecal transplants. I don't. My my thing is what my issue is the donor. So I would want to make sure that the donor dog was like pristine. And when I say pristine, I really mean pristine. I mean non-vaccinated, no flea and tick medication, been on a raw food diet, like, for at least 5 years. If it's a really young dog, then since it was a puppy. So I would dig into who the donor is and look at that. If you're hesitant to do the actual fecal transplant because you don't know a lot about the donor. I keep talking about legacy. I'll have to call them and tell them I'm really promoting them tonight. But I know that their poop pills are good. I know the donor with like the donors that they use with those. And I think that it's maybe easier if you're concerned and you're giving the pills, you can stop giving the pills. But once you do the transplant, if you actually do the transplant, then it's hard to undo. So if you're nervous, then I would go the route of probably the pills first and then see how it goes from there. Because like I said, you can stop the pills, right? And just make sure that if you do decide that you're just going to bite the bullet and do the transplant, then just be 1,000,000% confident on what the donor is. Like ask all the questions.
Thanks, Julie. The next question comes from Sue. Amnera says, thank you, Julie.
Yeah,
My,
and for him to be that sick for that long and then doing this well, he's older, right? He's 16. It could take a while.
Mhm.
It really could take a while. You could even try, sorry, I should have said this before. Love bugs and healthy gut. Why don't you try wolf? Sorry, add wolf to it. So you're not doing any species specific. So maybe adding the wolf probiotic would help to repopulate and get the dysbiosis under control a little faster. And you don't have to stop the other ones. You can just add it to his diet, or add it to add it to his probiotics. So that would be something, and give it, you can give it a little time if he's doing well and he's sick. If he's 16 and he's doing well, I always, um, you have to look at what's in front of you and not just always on paper, right? So I've seen lots of people go, "Oh my gosh, this dog is so sick," or "This cat is so sick," but they're doing amazing. They're having incredible quality of life. They're doing really, really well. And then I've also seen animals super, super sick, and you do all these diagnostics, and there's really nothing wrong with them. Like it's not showing up what you really need to show up. So you could try adding the wolf and giving it like another month or two before you do another microbiome sample, and then just redo the sample again. Or just basically, I was talking to a vet the other day that is like the fecal transplant plant expert, and she's always talking about that. It's like what do we see in front of us? Because what you see on a stool sample from a perspective of a microbiome is sort of a snapshot in time. It changes all the time. It really changes all the time. And for her, she's much more about what is she seeing in front of her compared to what she's seeing in the stool sample. And she's an expert at fecal transplants. So, maybe you want to just wait if your gut is telling you to, you're a little nervous, then try something else
Yeah, trust your instincts. You know your dog best.
for sure.
Okay, the next question comes from Sue. My dog has atopic dermatitis and issues and constantly scratches, and the only thing that helps is Apoquel, but I don't like it. What is there that I can use to help him that is natural? I'm hoping for some insight to help him. I just did the leaky gut protocol and have the Yeasty Beast 3 spray, and the one that you give in food or by mouth for yeast. So maybe the Yeasty Beast protocol. I'm not entirely sure. But is there anything else I can do? He eats raw. He eats a raw diet.
Yeah. So I think that uh so when you're dealing with Apoquel or Atopica or anything like that, you just don't want to throw the baby out with the bathwater and be like, "Oh, okay, well I don't like this." So because you're going to get something called a rebound effect. So what happens is when you're using a drug that is an immune suppressive drug, you're taking the disease and you're pushing it down. But the disease is still there, right? I mean, I'm sure that you know this. So you're not getting rid of the disease, you're just getting rid of the symptoms for now. The minute you stop the Apoquel or the Atopica or the Venectol-P or Pred or whatever you're giving, um, not only does it come back to the middle, but it comes back with a rebound. So it's being push, 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 push. The drug comes off and it goes like this. So then it even gets worse. So I like to make sure that even if your dog is on Apoquel, that you're doing you continue to do like you continue to do everything that you would do if he wasn't on Apoquel. So that you're building him up slowly so that once he comes off of it, there's not as much of a rebound effect. So we also you're on the right track. For sure, you're on the right track. We have, somebody can probably put it in the chat, Kaylin or whomever. We have something, if he's really, really bad, instead of putting him back on Apoquel, you could try something called our relief protocol. And the relief protocol is for animals that have to constantly go back on drugs. And is a it's a protocol that we use to try to get them once and for all off of the drugs. So you can try that. You could try the relief protocol as well, or you can still can like do the yeasty beast and see if he's getting better. But if he's not getting better, I would definitely probably switch, phone our customer service and talk to them about the relief protocol, and they can walk you through the relief protocol.
Perfect. Martha says, my 13-year-old dog has chronic pancreatitis. We have finally gotten her gut calmed down, and she's on a good, gently cooked raw diet, uses enzyme Diane, and several Adored Beast products like Love Bugs. She also has problems with yeast, which Adored Beast finally resolved. Yay! But she has had related problems with her paws, which have now had cytology done, identifying 3 different bacterial infections, 2 of which are strep and staph. She now has to start a heavy-duty antibiotic, which is the only one that will kill all 3 bacteria. How do I boost her gut and immune system while she's on the antibiotic for 30 days? I just ordered liver tonic. Given her situation, how often should I give it? Additionally, all the gut bacteria is going to be killed. The antibiotics will be twice daily. Should I give the pre and probiotics twice daily during this treatment? She has been losing weight since January and has finally gained 1 pound.
Oh, hmm, that's unfortunate. I guess it's really bad I guess her feet are really, really bad. Like, I mean, they look really bad and they're really, really bothering her, I would imagine. Because I get a little nervous that the antibiotics are gonna create a reoccurrence of her pancreatitis. I'm a bit more worried about that. Um, hmm. Can you, Martha, can you put in the chat maybe how bad her feet are? Like how much her feet are bothering her and how horrible her feet are, if you're still there. They look horrible. Wounds, weeping and bleeding, chews and breaks the skin. That's my worry too. The recurrence, yeah, she chews constantly. Mhm. When does she go on these antibiotics? I treat her with topical steroids and antibiotics, use a cone, socks, etc. Just to start in 2 weeks. Hmm. Well, oh, 2 days. Start in 2 days, not 2 weeks. Yeah. Hmm. That's unfortunate. Well, to answer your question, yes, you can give the pre and probiotics during. You should just do it 6 hours on either side of the antibiotic. So you're just going to have to, you'll probably, if you give them in the morning, you could potentially give the probiotics in the middle of the day and then try and stretch out the antibiotics to the end of the day so that the probiotics have about 6 hour window um, on either side of it. That would be good if you can do that. Definitely 1,000,000% liver tonic for sure. And when you do the antibiotics, once or twice you can do them twice a day so long as you can sort it out that you're doing the antibiotics and the probiotics 6 hours apart. So if you can do that 100%, you can do it twice a day. Um, the liver tonic, yes, for sure. And I would be so you did the love bugs. So in this case, I would be doing, and you can do them all at the same time, so don't worry. But I would be doing the soil and sea probiotic. and I would also be doing our wolf probiotic. So I would be doing a species specific one, and I would be doing a soil based one so that we and the love bugs that you're doing right now. If she starts to look the that way, you're getting a whole bunch of different strains, like a whole bunch of different strains. You're going to try to cover all your bases as much as you possibly can so that if the antibiotics or when the antibiotics kill everything, that you're going to try and continue to repopulate with as many diverse bacteria as possible. And then the end of the 30 days um, is when you would be really, you know, trying to do it. You would continue and you could even add more. After the 30 days, you could add gut soothe to that. You could add phytophthora. You could be rotating them, making sure that she's got um, really good fiber in her you said gently cooked. So, making sure that she's got lots of fiber in her cooked diet, like kale and squash and things like that, to lots of prebiotics in her gut. And it wouldn't even hurt for after that to do something with our Vital Defense. Like we have a product called Vital Defense, and that could help with a numerous because antibiotics don't just kill the the bacteria. Antibiotics can really shake up your whole system of your body. Like it can do some real damage. It really can. So, and I'm not telling you not to do it. I'm just saying that we have to really, really, really be on top of this to make sure, because 30 days is a long time. It's a really long time. So, yes, you can just do a rotation once after the 30 days. You can go to gut soothe, maybe gut soothe and soil and sea, and then wolf and phytos flora, right? So you're alternating them. So one day, maybe gut soothe for a couple weeks just to help with the dysbiosis and help make sure that her mucosal lining of her gut is going to heal. Um, and then mix in the soil and sea, and then maybe the next couple of days you could use the wolf, and then the next couple of days you could use phytophthora. Just try to get as many different things going as you possibly can.
Support, support, support.
Hmm. And
Hopefully,
like rebalance.
yeah.
The other thing, sorry, and you know what, I keep doing this. The other thing at the beginning, you know how we talked about you can follow, you can follow even the tick medication, right? Like it's still medication. It's still going to create havoc in the body. So you can definitely do those remedies, those homeopathic remedies, the phosphorus and the nux vomica and the aconite and arnica. You don't need to do the hypericum one for the nervous system, but you can definitely do those other remedies to support her, especially, you know what? That is what I would do. I would do those remedies because pancreatitis, the minute there's a lot of pain and inflammation associated with pancreatitis. So maybe if you're giving her aconite and arnica and phosphorus is an incredible pancreatitis remedy. Maybe if you're supporting her with those remedies, then maybe the chronic pancreatitis won't rear its ugly head with all of this. Fingers crossed. And you can do liver tonic 2 and 3 times a day when you're doing this as well.
And I think that's a really good thing to point out because there have been a few other questions in the chat. Can I use, this detox protocol for this and X, Y, and Z? And you can use it for detoxing for anything, any threats, environmental pesticides outside, any kind of medications. This protocol that you've given it detoxes the whole body. So it's not
Yeah,
just for flea and ticks. It's good for general for every dog.
yeah, for sure.
Okay, Michelle says, I have been struggling with my dog's allergies since I got him a year and a half ago. He's just over 2 years. We did 6 months on the leaky gut protocol, which helped his gut tremendously, but did not help the allergies. He finished the Yeasty Beast protocol last month, which I didn't see any changes with. He is currently on Medicus Skin Health Diet and started Herb Smith Clear Allergy just over a
Yeah.
week ago. Sorry. His itching is primarily ears, armpits, and chin. Is there anything else I can do to help him?
Michelle, can you write in the chat if you're in the US or in Canada, please? US. Okay. So what we've seen cases like this, what we've seen has been really, really helpful is our positive immunity. We're having lots and lots of success with positive immunity. So I would try that. I would try adding positive immunity. I would continue. It's interesting. I would continue. So if you're not getting results with UCBs, it's probably not primary yeast, right? The itching is probably immune mediated. So like a an autoimmune situation going on. You may have to, yeah, what I would do now is I would do positive immunity and phytophthora um and liver tonic. So he's also been on Wolf probiotics. Okay, that's good. That's good. Um, but I would try the positive immunity because it has a completely different approach to allergies and a super strong detoxification as well. So it doesn't stimulate IgA and IgG systemically. So it doesn't enhance the allergies because sometimes colostrum can definitely make it worse. So I would try positive immunity um, and liver tonic, and you could try you've tried the when you tried the wolf. Did you try it when you was on the leaky gut protocol? Can you tell me if you tried the wolf when he was on leaky gut protocol or was it after? Um, think she's answered it yet. Oh, Michelle. So you did it when he was on the leaky gut protocol. I put him back on. I would put him back on the with the leaky gut, and it helped. So yeah, I would do positive immunity again in the wolf and liver tonic. That's what I would do. You're welcome.
The chat has been very helpful tonight for this
Yeah.
back and forth. Catherine asks, I'm wondering about skin tags. My Doberman has a huge clump. She sleeps on a blanket, started to give her vitality. I'm assuming vitality mushrooms. That's all we have.
Um, Wondering about skin tags. My Doberman has, well, Dobermans tend to get skin tags too. So for skin tags, I would, oh, where'd it go? Oh, there it is. Um, Skin tags, I would do rebalancer. So I would do rebalancer like twice a day for even up to a month. And then I would do vital defense. Um, do you think she doesn't mean vital defense? Do you think she means vital defense, the vitality?
I was thinking vitality mushrooms, maybe,
Oh,
but
maybe.
it could be vital defense. I'm not sure. Are you still here,
Okay. Wonder if
Catherine?
she's still there. Catherine, are you still here? Not sure. If you are, can you? I would do vital defense because if we're looking at anything taggy, tumory, anything like that, vital defense would be the one that I would definitely start along with along with a probiotic, probably Phytophthora, and then I would do what is vital defense? Oh, so vital defense is a formulation that I we developed. Some of the research comes from a cancer research project that I did with Dalhousie University, and it focuses on cell health. So, um, helping to derail uh, things that cause the cells to become oxidized and super stressed. So I would try Vital Defense with your dog, Rebalancer for sure, and probably Phytophthora, which is a species-specific probiotic. Oh, yeah, and for skin tags with zero, also using Vital Defense, rotating with turkey tail. Amazing results for everything except the skin tags. Isn't
That's
that
not,
interesting?
yeah, that's not Catherine.
No, that's a
Oh,
different person. Yeah.
okay, sorry.
Yeah. Yeah. Well, depending how big these skin tags are, too, right? I mean, they can, what you want is sometimes if they're really big and they've been there for a long time, your big goal is that they don't just keep producing, right? And then they don't turn into anything scary. So that's something that you have to also remember. Lorene, is that Lorene? Sorry. Is that if they stay benign and just dormant, that's something that you work towards as well. So you can have skin tags removed. The problem is that they just grow back often. But if you're doing the things that support the body to not regrow them, big, that's a that's a big difference.
I think that's lots to help try and
Yeah, yeah. Wonderful.
okay, next one. This is kind of back on our flea and tick, which is good. Dee Dee says, Wonderside has such a strong smell, even to my human nose. Wouldn't the smell be downright painful for a dog's nose?
Yes, it is. It's stinky. It's there's one that I don't know whether it's the peppermint one. That's a little less. I used it once and it was, yeah, you're right. You're right. It's so intense. Um, that's why I'll recommend Atlantic Tick, or I'll recommend Sustainable Herbs Internal, or I think Rita even maybe has a formula or a recipe for it. So there are a few out there for sure. But if you're in an area that's really bad, then what you can actually do is you can spray it. Like I would never spray it around my dog's face. No, their eyes, face, no, because it's so intense. Like a dog's nose, you're right. Like it's pretty brutal. But sometimes I've sprayed it on a cloth and then I've put it on their stomachs and down their legs if I know I'm gonna go in an area that is just like horrifically brutal for ticks. And then I'll try and wash it off a little bit when I come back. So I'll use Wonderside only when I'm going into something that is intensely scary, for lack of better words, when it comes to ticks.
Yeah, we're using Atlantic right now, the one that you recommended earlier,
Yeah.
and the our girls, it is a strong smell as well. So we'll spray it on bandanas. Or the Atlantic company also has lava bead like necklaces for collars.
Yes.
So we spray
Yeah.
them, but we let it sit for like a good hour so the smell dissipates. Same with the
Yeah.
bandanas, the smell dissipates and then it's
Yeah.
not so intense in their face, and then we just spray their bums, you know.
Yeah. So
So
you're kind of like, and then brush them like you know what when
a
you
bit,
come back
yeah,
and look for ticks, right?
yeah,
So that, yeah, when you come back in.
yeah, yeah. Bandanas are great.
They
Christiane,
are because you
as
can take them
well.
off to get
Yeah,
inside.
that's
Yeah,
it.
they're really good.
Okay, next one. Lisa's asking, do you have a protocol for lepto?
Mm. No, I don't. Not one that I could talk about on AJA, unfortunately. I have got lots of protocols that I'm not allowed to talk about on publicly. Uh, there, I know it's hard, but there is, you just, I follow preventatively, like to try to prevent it. I do follow similar stuff, but, um, there's a fine line what I can talk about and what I'm not supposed to talk about. And lepto's one of them, parvo's one of them. There's a few that are, uh, we don't have a blog on lepto though, do we?
We do.
Oh, we do?
I'll share it.
Oh,
Yep,
okay, cool.
I'll share it. Aaron says, my 3-year-old Aussie is due to take a heartworm, and I really do not want to put him on it anymore. I'm wondering what are the ways to ensure he does not get heartworm.
You know who the I love is Dr. Ruth, or what's her, do you know what's her last name? The one that has the coaching. Oh my gosh, I never ever remember people's names. I'm the worst person in the world. Um, oh, Ruth Roberts, thank you. She has the best information on heartworm. So that would be someone I would definitely reach out to because it's very specific. So she has very specific rules and regulations kind of around heartworm and where you live, the age of your dog, like the whole nine yards. So I kind of move all my heartworm questions over to her because it really depends on where you live.
Sorry, you can tell I'm new at this because I keep leaving myself on mute. All right, so we're at 8:27 or 9:27 or at something 27 here. So I'll make
Yeah.
this the last question. What do you
Okay.
think about nozodes? So t for tick pathogens and nozodes for Lyme specifically.
Yeah. Well, I think I'm a homeopath. So, I love nozodes. I love them. It's not like, um, I never think that they're gonna do any harm. I only think that they can do good. And there's lots of different tick ones, right? Like there's Bartonella, there's Anaplasmosis, there's lots and lots of tick homeopathics. If you can get them, it sure doesn't hurt to use them.
Okay, so there's still lots of questions left, but it's late for Julie and Michelle out there and anyone out in Atlantic time. Do you have anything you want to say to close out?
Well, I mean, ticks are I think the more you research and the more you know what, there's a really good doctor that what's his name? I have his book actually. It's human. Lyme and tick-borne illnesses are really, really misunderstood, right? Very misunderstood. And they are scary, but we have to really get our heads around, in my opinion, like why, like what's going on with them, like why are they becoming more rampant? And this is sort of like maybe my little environmental rant. Um, so yes, we can protect our dogs, we can protect ourselves as much as we possibly can. Does the protection outweigh, the benefits, right? Like from a perspective of how toxic they are and how often they have to give them, and do they fully protect them and have to do them every year? And ticks are getting worse and worse and worse every year. So I think that we're going to get to a point where they're going to be, we're going to have to find antibiotic resistant. We're going to start getting, and we're going to start getting, instead of antibiotic resistance bacteria, we're going to start getting these tick-borne illnesses that are resistant to treatment and to prevention and all that. So our environment is the number one thing that we can lean on for ticks. And there's lots and lots of different things that, like, just like you should Google if you want to Google, um, uh, what is a ticks, like what preys on ticks, right? What kills ticks in nature? What kind of animals? Like, I mean, we know, guinea hens can do them, and then they're like, oh, they don't. I can attest that guinea hens do help, but birds, frogs, lizards, spiders, all the things that, glyphosates and different, all these crazy pesticides and insecticides that we're using and overlogging and it, we always think that, environmentalists are just worried about the birds and we're just worried about the wildlife. It's not. It's when we deplete nature as much as we're doing, we are going to see the side effects of it. And they're going to be side effects that we're not going to be able to fight against, like ticks, right? We have so many ticks because we've destroyed their predators by using so many chemicals and deforesting things and losing all of our reptiles, especially things like salamanders and things like that. So, if you can, even in your backyard, get like barn swallow houses up and try to leave a certain amount. They say, oh, you got to get rid of everything, right? You got to get rid of your leaves, you got to get rid of your trees, you got to get do this for ticks. But certain amounts of bush that fall will help things that prey on ticks to eat the ticks. So, we just really want to never just focus on what's going to kill something, what's going to eradicate something or kill something, because it never works. It always kind of bites us, comes up and bites us in the you know what after. So I think it's important that we pay attention. Why do we have so many ticks? Because if we don't, in a couple of years from now, I don't even think we're going to know what to do with them.
Yeah.
It's going to be scary.
It's a very scary prospect.
It is. It's awful. It's creepy. I don't not like anything. Like I save everything, moths, everything. But ticks, oh my gosh, and I try to talk to them. I try to be like, okay, you know what? We just have to all live by, we all have to live in the planet, so let's just take care of each other. But it just creeps me out how bad they get it. How every year they're in a different state, every year they're in a different province, every year they're bigger. It's like they're coming for us. So we have to decide how we're going to defend ourselves with ticks, and that is by supporting other insects and other birds and reptiles and spiders and stuff like that.
Yeah. I'm paying attention to the chat. We've got, Kaylin's in there. Her chickens do a pretty good job in the backyard, and someone else saying frogs living rent free in the backyard, and
Yeah, I
those
totally
things that
agree.
are going to
I
take care of
totally
us.
agree about what you feel like ticks that they are coming for us. But you know what? It's kind of true. It's kind of creepy and no one's really looking at this, right? Like everyone's talking about flea and tick medication and big pharma's making gazillions and billions of dollars and doxycycline, I'm sure is like the most expensive antibiotic out there now. Like we're not paying attention because soon ticks are going to be like, what? Doxycycline? Yeah, we eat doxycycline for lunch. You know, they're just, that's what's going to happen.
Yep.
They're just going to get more and more because we aren't paying attention to what, like, we don't pay attention to the gut and that's why we have allergies, or we're not paying attention to this because we have this and we're suppressing it with this instead of looking at the core issue. What's the root cause? We need to look at what's the root cause of ticks and back it up and try and figure out how to navigate them. You know,
Yeah.
what don't we have that we did have? What animal, insect species don't we have now that we did have when ticks were very controlled?
Mhm. Yeah, exactly. Big picture. It's all connected.
Yes. Okay, so don't everybody go to sleep and have nightmares of big, huge ticks. Come and get them, please. All right. Well, thanks very much.
Thanks everyone for joining us. As mentioned, we'll send this out to all registrants. Um, in the next few days, Michelle's going to have it up on YouTube for you and share it on Facebook. Remember to follow us on Facebook if you're not. You're here, so you'll be signed up to email and keep track. And we hope this was very helpful. I know that there are things, I'm with Julie every day and I learn something new every day. So I hope this was as helpful for everyone as it could possibly be. And again, we thank you for joining us and have an amazing evening.
See you later. Bye.
Bye.